Hey,
Sorry.
hi, how are you? Having a little fun today. My name is Sam Goodwin with Hocoa, your home prayer network, and today we have Joey Houston with the RevMed company. And Joey's a friend of mine, somebody that can really talk to you, or her company really helps people and also helps doctor offices. But before we get into that, Joey, you're an RN.
Yes.
How did you get in? How did you become a registered nurse?
A long time ago, I just thought I wanted to help people, make them feel better, and the rest is history. I wanted to get into nursing to be able to have a career, and it took off from there. I fell in love with maternal child health. That was my favorite specialty. So doing that in the hospital care setting and then going to the clinical setting, there was no end. You can go into any specialty, any setting you like. That's what's unbelievable.
And you became a travel nurse, right?
Yes.
That's pretty cool. If you can share a little bit about that. I mean, you would go to a place and stay for how long?
For 3 months. Yeah, that's the most fun. You can go, each of your contracts are about 3 months long, and you can travel anywhere you like. Even internationally. Internationally, the minimum sometimes is about a year.
Oh, wow.
But I didn't want to do that. I miss America and American food, so I didn't want to do that. But 3 months at a time, I've been from Palm Springs all the way to St. Thomas.
Oh, wow.
So
that's pretty cool.
I've gotten to see a lot of cool areas.
And then you said you mentioned clinical, so you got onto the clinical side where you actually worked in like a doctor's office, right?
Right, yeah. I worked in a dermatologist's office. That's where I did a lot of aesthetics, making people prettier, happier. Well, we were removing hair.
Oh, okay. Well, I need to add hair.
Yeah.
That's what you're saying. No, and I understand. I get that along. It's fine. But so, is that kind of how the brainchild of MedRev? Because you've been a patient, you've been in the back office, working with medical practices. You've seen it from the consumer standpoint of some of the difficulties in dealing with medical practices. So is that how it started?
That is exactly how it started. It's seeing the flaws between the front end and the back side. Not everybody has been a patient and worked in the back office as a nurse or doctor. And so when you see the breakdown between both, communication-wise, it's a tough day at work when you have that. But if you can make that a little bit smoother, that process a little bit smoother, your doctor's visit is a lot better.
Yeah.
And you don't have angry patients.
Frustrated patients like myself that get bills in the mail from, and it's like, why didn't my insurance come? But anyways, that's a whole different story. But it's privy to this because that's something that you're able to go in and offer help to doctor offices is all these different things and tasks that they have to do, right? I mean, there's billing, there's the HIPAA thing that's like, oh my gosh, if you break it, and there's, they have to collect and they have to do all kinds of stuff. So, and that's pretty cool. And you help with that. I mean, you're kind of like what I like to say is the Hocoa of the medical field, where you have the expertise, the people, the staff, you have one point of contact.
Yeah. An umbrella of services. We are the Hocoa of medical practices.
Right.
That's right. It's easier for a business to go to one company and look at all of their services and deal with one person versus having to have 10 contacts for 10 different things.
Yeah.
It's a lot easier.
A lot of phone calls you got to make.
Yeah.
That probably helps the bottom line for the doctor's office too. I mean, they're able to streamline and kind of keep everything processed and systemized.
Right.
What about the genetic testing that you're kind of on the front lines of, and that's pretty cool, interesting stuff, and can save the consumer a lot of headache.
Yeah, and you won't get that nice bill at the end.
Yeah.
It's actually pharmacogenetic testing.
Okay.
Or PGX for short. And what it is it tests the person's DNA through a cheek swab, and it determines how a person metabolizes medications. So it can identify what's safe for you and what's not right from the start. You don't have this trial and error guinea pig effect of, let's start you off with this pill at this dose, and if it doesn't work, come back and we'll test you again, and we'll start all over. So it's saving you time, money. You don't get the big bills because you're going through office visits, ER visits. No one wants to go through adverse drug reactions.
Paying the copay and then finding out this is not working. I need to get in right away and do something else.
Right.
So this test helps you determine, like, hey, you want to stay away from these. And these would probably work best with your, based on your DNA.
Right. So you're not going off of any animal tests or any case studies, no international study. You know, it's specific to you, to
Right.
your metabolism. So it will actually give the doctor a very clear picture where to start.
So I can go to my doctor and say, hey, this is what I need.
You come to me, I'll write you a letter. That's
There
the
we
best way
go.
to do it.
Okay.
To get that conversation started, I'll write you a customized letter with your name, your doctor's name on it.
Cool.
You take that to your doctor. They will have my information on that letter, and they can contact me and I'll answer any question that they have about it. And then when the time comes and the doctor says, okay, we're all for it, let's get started.
Okay.
I go in and I actually train them and I provide all the supplies.
Oh, wow. No
So
kidding.
I'll be there as your backup.
But how much does it cost? Is that
So
the
it's
kicker?
covered by insurance.
Oh, it is.
It is covered by insurance. Medicare,
Okay.
private insurance, PPOs, Medicaid.
Wow.
Yeah, it's all
Well, that's good
covered.
to know then, right? I mean, that's probably one of the fears that people think, oh, it's going to cost a bunch of money, but
Yeah.
it's covered by insurance.
It is covered by insurance. Now, those of you who don't have insurance, there is a cash payment,
Okay.
but you and the lab can pretty much coordinate how you want to
Cool.
make the payments, installments, or if you just want to go to a different doctor and try them.
Okay.
So there's always options, but it's better to be safe, right? You're
Right,
going to save
yeah.
yourselves a lot of money at the
Yeah,
end.
and a lot of headache of trying different pills, not knowing what's going to work with your body or what's not,
Right.
based on your DNA.
Well, and the worst is when you're taking combinations of medications and you have no idea what's going on inside.
Wow, yeah, that's probably bad stuff.
Yeah, and people think, oh, well, I'm feeling kind of sad today. I don't know why, or my stomach hurts. There's
yeah.
just a range of side effects that you can have.
Wow. So, how do people get in contact with you if they want more information, whether it's for the PGX test,
Yes.
or if there's a medical practice, whether you're a chiropractor, orthodontist maybe? Can you help those folks?
I can do some things with
for them,
orthodontists,
see?
yeah.
Anybody
yeah.
in the medical field per se, you can probably help.
I can.
How can they get in touch with you?
Well, my direct number is 310-592-4252, or you can email me at jotika@medrevmgt.com.
Perfect. Well, Jotika, thank you so much for meeting with us today and
Thank you.
coming on our Facebook Live. And feel free to comment, share, and reach out to Jotika anytime. Well, not anytime, but questions. And if you have any questions for us, also reach out to us. Thank you so much for coming on today.
Thank you.
Appreciate it. Happy holidays to everybody
That's right.
out there.
Merry Christmas.
Merry
Happy New Year.
Christmas, Happy New Year, and we'll see you next week, not next year.
That's right.
I'll be here next week. Somebody will be. Thanks so much. We'll see you.
Bye, guys.
Bye.